We continue to talk about healthcare today in our Blogger Bunch segment. We're doing something a little different today. Instead of actual bloggers, we've brought a panel of experts to walk us through the healthcare reform plan. It's certainly a topic that affects you, it affects me, it affects really all of us, and it certainly affects bloggers, and they're talking about it on the web. While I chat with them, Namwal Delaney is keeping an eye on what you are saying out there on Facebook, on Twitter, and on our Your Voice. Hey, Namwal.
Yes, Reggie, people will have plenty to say on this topic. I want to just give you a sense of what we're receiving. This is a Your Voice comment that we had coming in from Scott, who wrote, "I'd be happy to pay an extra tax to have healthcare coverage. I work very hard, but I don't get coverage. And if I did, I wouldn't be covered due to pre-existing health problems. Tax me and give me healthcare." So that's Scott. We'll get to the rest in just a couple of minutes.
Okay, well, let us introduce the people that we have today to talk about it, our experts. First, we have healthcare advocate and clinical psychologist Jane Delgado. Jane, it's a pleasure to have you here.
Good to be here with you today.
We're also joined by Dr. Jack Lewin, CEO of the American College of Cardiology. Dr. Lewin, it is a pleasure to have you back.
Thank you very much. Great to be here.
All right, so there is no shortage of information out there about this plan and about the various problems and successes in our healthcare system, and yet it still seems like people are very confused about what we should do in this country when it comes to healthcare. So I'll start with you, Dr. Lewin. We have talked about this before, but the way in which doctors are paid is part of the problem. We were just talking to our congressional correspondent, Breonna Keeler, who was saying that these blue dog Democrats, the fiscally conservative ones in the House, they want to see a provision in this bill which would make it so that doctors are paid for the quality of their care and not the quantity of their care.
That's absolutely right. I mean, the president's right on. We need health care reform now, but we need to do it right. And one of the most important things to do here is to improve quality. The irony in America is that the highest quality care is not the most expensive care. And so by improving quality and paying and having incentives for quality of care improvements and outcome improvements rather than just volume of care, we can bend that cost curve and provide access to every American. That's what we've got to do.
Maybe we should explain, Dr. Lewin, how doctors are paid right now. How does the system work and what's wrong with it?
It's called fee for service, and you get paid for every service, every visit, every single little unit. In hospitals, they get down to get paid for every Kleenex and so forth. So we're paying for individual services, not for improving care. If we paid by, over time, taking care of a group of people to improve their prevention, improve their outcomes, improve chronic disease care, we'd have a much more efficient system. And in fact, there are examples of this kind of excellent care in America today. Geisinger, Mayo, Kaiser Permanente, many systems are paying in that way. We need to get the 85% of America that's in this fee-for-service model moved into a much better system. And for doctors, fee-for-service is crazy. You know, you've got to have a whole bevy of people working for you to deal with the complexity of billing for this in this broken system. We need payment reform that incentivizes quality, and the American College of Cardiology has been pushing that all along.
Jane Delgado, let me ask you, if you are in one of these committees drafting this legislation, what would be on the top of your agenda?
Well, the top of my agenda would be something that all the committees agree upon, that insurance would no longer discriminate against people with pre-existing conditions. And the second thing is that women would no longer pay higher fees. Those are two very important things. The third thing is that everybody would be required to have health insurance, and for those people who are low income and for small businesses, there'd be incentives and help to let them provide them. So those would be at the very top. I think everyone is talking about it, and that's key to changing the way that we do healthcare in America now.
And Jane, how would we pay for such a thing? There have been various options thrown out there, including taxing the wealthier people in America to pay for some of the people who don't have as much money.
Well, what Speaker Pelosi said today is that for an individual who earns $500,000 a year or more, that they would be paying an extra 5%, and if you are a family earning over $1 million or more, you would be paying an extra 5% to provide health care for everyone who is not covered now. I think this is a great way to help pay for the kind of America that we all want to have.
I want to show you guys a graphic that we have prepared that shows you just how much more we are paying in the United States for health care. It compares 1999 to the year 2008, and it shows us, this is from the Kaiser Family Foundation, it shows us that we are paying about $1,500 for insurance premiums back then in 1999, and in 2008 that number went to $3,354. So we're all paying more for this. But it was interesting, Dr. Lewin, that in the New York Times today they had an article that said 90% of voters have health care. And they were saying that may be part of the reason why a lot of Americans are a little hesitant to support some of these plans coming through Congress right now.
Well, the president has said you can keep your health care if you like the plan that you have today. He's made that point very clear. But, you know, we also need to, all of us, need to make sure that the costs don't continue to skyrocket the way they are now. We can provide high-quality care at lower costs if we change the payment reform system, as the ACC has been trying to push through this whole effort. We also need to measure our way to higher quality with electronic health records, clinical decision support systems. That's a way to reduce disparities, improve quality, and actually to be much more efficient than we are today. We can fix health care, but we've got to do these things, and we've got to get these elements in the bills before Congress.
All right, we're going to talk to you and get some reaction from our viewers right now. Let's go over to Namwa Delaney. She is monitoring what people are saying on our various social media sites. Namwa?
Yeah, Reg, you're going to start off with Facebook here. Jake saying, I think the government should jump out of any type of regulation on healthcare. Everything the government has begun to regulate has had a price increase. Let's move along now to Chad, who has this to say. If anything, I anticipate the introduction of this public option plan will drive costs down across the board, both to the taxpayer and the government at both the state and federal level. Even if you assume the taxpayer will pay more in tax, the potential health care cost savings could hugely outweigh it. So Chad putting the counterpoint there. And let's finish up with Newton, who says, it is time Americans start thinking about our country as a whole and not just a group of individuals. All arguments against healthcare reform are either claims of isolated incidents or greed. So, Reggie, there's just a sample of what people are saying online right now.
Well, let me ask this of Jane Delgado, because a couple of our writers who've been watching this segment are worried about this public option. And I guess there are several concerns there. One of them could be the quality of care that they may get compared to what they're getting from private insurers right now. But the other thing is, what's the incentive for companies not to drop our insurance that we already have in lieu of a public option if it's there and the government's willing to pay for it?
Well, remember several things. The public option is not there in and of itself. That we're talking about a whole change, that pre-existing conditions can no longer be used as a way to push people out so that you're going to spread risk around. There's plenty of opportunity for people to provide a benefit which is very good for their business. But the other side of it is that the irony is that the insurance industry is often saying, well, if we have a public option, it's going to drive us out. It is amazing to me that in this country where everyone complains that the government is inefficient and can't do anything right, that all of a sudden when the government is thinking of having a small option for people who can't get any other coverage, that people are concerned that they're going to do it so right that they're going to drive everyone else out of business. That doesn't make any sense, and it doesn't follow with the experience we have. The other thing is, many of these companies have not provided for those small businesses or individuals who need to have health coverage who have not had it. And if those people are covered, that makes our country better and stronger. And if the companies aren't doing it, then the government has to step in and do its part.
Dr. Lewin, you represent an organization that has something like 35,000 members. What has the reaction been of late to some of these proposals that they've seen in Congress? And is there a concern that we might be rushing such a huge topic through our system?
Cardiologists and cardiovascular nurses and pharmacists, the American College of Cardiology, we really want to see reform. We want to see it happen this year. Critically important for the nation. We do want to see more quality and payment reforms in there. And in terms of the public option, I think there's a lot of confusion about this. You know, what we think is really very positive in the House plan is this, it's a purchasing cooperative that would be available in every state that would allow you to get choices of health plans, and these plans would be more affordable because there'd be people competing, a larger group of people competing for this. Actually the purchasing cooperative, like the Congress has, is probably the most important thing. Everybody would get more choices of plans. The plans would be more competitive. Inside that purchasing cooperative, which would be there for small businesses, low-income people, uninsured persons who don't have coverage now, they'd be able to use this purchasing collaborative. Inside that, there might be a public option that would be like a Medicare plan for people there. It's the purchasing collaboration and the insurance reforms that are actually the most important elements of that. and everybody should support those elements, and we certainly do.
Dr. Jack Lewin and Jane Delgado, really interesting conversation. You guys are certainly experts in your field, and you know this from all sorts of angles, both the doctor-provided angle, but also from the patient side as well. We appreciate you being here. Thanks so much, and I hope we can talk to you again, because it ain't over yet, is it?
Nope, thank you. Thank you very much.
Thank you.
Thanks, guys.